I don't want students to be distracted by a concern about money. I think they should be distracted by how are they going to help this mom with the loss of her child, or how are they going to help this person acclimate to being home with diabetes and they don't see well so they can't take care of themselves. That's the kind of problems I want them to work on, not problems about money. And I couldn't think of another way to contribute to the school's future except by this. My name is Karin Alaniz. I'm a nurse and proud to be one. I got my master's in '77, and then I started teaching at the University of Minnesota School of Nursing. I think finances are one of the biggest challenges right now for all of our students, no matter what their major is. They sometimes can't afford to be in school.
I was born in Malaysia in a refugee camp. My father was in the U.S. at the time, and he was just working hard to get money and just gather resources to transport my mother and I to the U.S. to be with him. My dad finally found the funds to get us to the U.S. Honestly, just thinking about the tuition and how expensive schooling is, it's incredibly daunting. And coming from a family that was incredibly frugal, we discussed a lot, and honestly, they wanted my education above all else. So they were willing to work even harder than they did before to be able to pay for my schooling. I was really excited and everything about going to nursing school, but at the same time I was just so scared. And so there was a lot of things going through my head. How am I supposed to pay for this? I got in, but I can't even stay if I can't pay for it.
And that's an example of things that we don't necessarily hear about when we're talking to students. So I decided to put a scholarship together, and the minute I decided to put the scholarship together, I knew it was the right thing to do.
And then a few weeks later, I got the scholarship letter, and it made me realize that it's actually me going to a nursing school and becoming a nurse is now actually real. It's more concrete now. Just incredibly happy. I cried, and I'm getting a little emotional right now, so being able to get further in life, and it's not only about helping others, it helps me kind of repay the debt that I owe my parents, basically. They've helped me out so much, and I just know that if I complete this degree and become a nurse, I can take care of them, and the roles can change.
Growing up in rural Minnesota, I was really able to see that lack of specialty and pediatric care. I know families with children with special needs are driving hours, sometimes several times a month, just for simple appointments, and I want to be able to alleviate that stress for them and bring quality pediatric care into rural communities. When I was younger, my mom always told me about how she wanted to be a nurse. It really wasn't financially feasible for her at the time, so it was always a dream that she never was really able to fulfill, and that always resonated with me. And I was fortunate enough to get the Benson Scholarship, which has made it so much easier for me to focus on my school and make that the priority, and give that the attention that I need to be successful in the program. I was in shock for a long time after I got the acceptance letter, and I called my mom, and it was a lot of tears. After I got it out, she was like, I didn't know if this was gonna be bad or good because I just heard you crying, and then she was crying. So it's good to make her dream come true through me.
I'm really interested in critical care. That's where I'm doing my immersion right now. I'm in the intensive care unit at Hennepin County Medical Center. I really like the complexity of what I've been seeing. I like the analysis of the physiology, and then I really like the communication with the families. I feel like families in the ICU really depend a lot on the nurses there. They ask a lot of questions. They need a lot of reassurance because it's a very scary environment if you've never been in there. And the nurse does a lot to explain, to ease some anxieties, to ease some fears, and help families kind of recoup with what's happened to their loved ones. You know, it's meant a tremendous amount to me. I think when we are able to learn the best is when we have some of those extraneous variables lessen, the worry around that. And these scholarships do that. It allows me not to think so much financially. What it allows me to do is commit more to my learning, gain more knowledge, and then become more competent when I enter the hospital floor.
Thank you for just giving me the opportunity to pursue my dreams as a nurse, because without you, I wouldn't have gotten to where I am right now. Without you, I wouldn't be in classes. Without you, I wouldn't be able to work for the underserved community in the future. So I really, really appreciate that.